Hello, and I don't know if it's afternoon or morning still, but good day. Thank you for joining us. It's always hard. We have the shortest person go first. We have to do a microphone adjustment, and I'll pop it back up for everybody else. My name is Kristen Hauser, and I'm the Deputy Secretary of the Office of Mental Health and Substance Abuse Services at the Pennsylvania Department of Human Services. And we are here today to recognize Suicide Prevention Month. This month is a time to remember those that we have lost to suicide, to support all who are affected by suicide, whether that's as an attempt or a lost survivor, and to remind anyone who may be experiencing suicidal ideation or who is experiencing a crisis or feeling hopelessness that help is always available. Nearly 1,700 people died by suicide in Pennsylvania during 2020, which is the most recent year the data is available. Every one of those deaths impacted numerous other people who grapple with unanswerable questions, a mix of complex emotions, and for many, fears of being stigmatized and isolated if others knew the truth about how their friend or loved one died. Stigma about suicide is what keeps people from talking about it. And that stops people from asking for help for themselves, for someone they're worried about, and from giving meaningful support to survivors. We're here today to talk about suicide honestly, and to remind everyone who is worried for themselves or for someone they love that no matter what you are facing, your experiences are valid, your feelings are real, and you do not need to carry them alone. First of all, help is available that is free, caring, and confidential. If you or a loved one is in crisis and needs someone to talk to, you can call or text 3 simple numbers, 988. Calling or texting 988 will connect you to a trained mental health professional who works as part of the National Suicide and Crisis Lifeline. In Pennsylvania, we have 14 call centers that answer calls to 988, and they work with people across Pennsylvania every day and offer support to those that are enduring their most difficult moments. 988 is a resource for individuals in crisis, as well as for people looking for the best way to help a loved one or someone else in need. 988 can also connect people with local services and resources, and callers also have the ability to be connected to specialized services, including the Veterans Crisis Line or assistance from a counselor in Spanish. We must all do what we can to foster more open, compassionate dialogues around mental health, crises, and suicide. Each of us has the ability to be a support for people in our lives when they are struggling. And some simple tips include, if you're worried about someone, don't ask them what you can do to help. That just sort of puts pressure on somebody who's already struggling and feeling overwhelmed. Instead, just pick something and do it. You can drop off a meal, offer to walk their dog, mow their lawn, pick up groceries, any number of things that ease the load of daily living that may be adding to somebody's sense of burden or being overwhelmed. Say what you see. Name the behavior changes that you've noticed and name your fears. Get it out in the open because suicide and suicidal ideation happens in secret. So by saying, I care about you and I'm worried about how withdrawn you've become, I'm worried that you might hurt yourself, it brings it into the open. You can offer to call 988 with them, to sit with them when they make the call, to offer that support to take the step to get help and get connected. Checking on people, sharing resources and stories on social media, and demonstrating that you are willing to talk about it are simple steps that can help someone feel safer working through their own challenges. So please share the resource of 988 and use it to get more information about how to help friends and family if you are concerned for them. Thanks to the Wolf administration, we've made progress in recognizing how essential mental health is to our overall well-being and our quality of life. The reality is mental health is health. When your mental health is struggling, your overall health is struggling. It is important that we recognize connecting a person to support services for mental health is often not enough. We need to address the social and economic hardships, and this is really critical if we are serious about preventing deaths by suicide. We know that social and economic hardships can add to feelings of despair and hopelessness. At the Department of Human Services, we administer Pennsylvania's public assistance system, an array of programs that help individuals meet their most essential needs, including medical care, prescriptions, access to food, and housing, among others. These programs may be able to help reduce stress and anxiety for those that are experiencing financial difficulties. And if the Department of Human Services cannot help directly, we can make referrals to other community organizations that may be better able to assist. More information about the programs at the Department of Human Services and how people can apply for them is available online at dhs.pa.gov. So thank you again for taking time out of your day to join us. And I would like to now introduce my colleague, Dr. Denise Johnson, Pennsylvania's Acting Secretary of Health and Physician General.
Thank you very much. I'm very glad to join my colleagues here to lift up the public health crisis of suicide. Suicide affects us all, as you heard, not only those families and loved ones, but really our entire society. And all of you here who are representing the supports that are available to individuals, I want to thank you for your work, and we join in with you. I'm an OBGYN physician, and maternal health and wellness is very, very close to my heart. We know that in pregnancy and after pregnancy, up to 1 in 5 individuals experience a crisis in their mental health. We want you to know that in addition to the 988 line, there also is a specific line for mothers who are dealing with mental health challenges, either during pregnancy or in that postpartum period. That can be a difficult time. There can be overwhelming stressors as well as physical issues that worsen a mental health crisis. There is a number that's available. It's 1-833-9-HELP-4-MOMS. Again, that's 1-833-9-HELP-4-MOMS. This is a line that is confidential, it's free, it's available 24/7, available in English and Spanish. As another support, we all stand with you to offer supports to individuals to help them realize their full health potential. And I'm glad to stand with my colleagues today. Next, I'd like to introduce Major General Schindler from the Department of Military and Veteran Affairs.
Thank you, Dr. Johnson. It's great to see so many agencies and community partners assembled here today, unified by a common goal to raise awareness about suicide prevention. At the DMVA, we know how serious a problem suicide is in the veteran community. Approximately 20 veterans die by suicide every day. Dr. Martin Luther King Jr. once said, "There is power in numbers, and there is power in unity." That is what we have here today. Together, we have the power to raise awareness, share valuable information, and ultimately save lives. National Suicide Prevention Month is important, but we need to keep the suicide prevention conversation going every day. At the DMVA, we work to support veterans in crisis, including taking the lead for the Pennsylvania Governor's Challenge to prevent suicide among service members, veterans, and their families. On a larger scale, across the Commonwealth, we continue to grow and strengthen our award-winning PA Vet Connect initiative. At the Pennsylvania National Guard, our suicide prevention team of professionals works at the unit and individual level, providing resources for behavioral health challenges, as well as implementing substance abuse programs. Through these efforts, we are reaching our currently serving Guard members and providing those in crisis with life-changing and even life-saving information and assistance. Most recently, DMVA rolled out a Caring Message social media campaign. A caring message is simple to send and can take the form of a letter, a text, an email, a phone call, or any communication. I'd encourage everyone here today to reach out to a veteran, a family member, or a friend, and remind them, that person, how much you care. If you're a veteran in crisis or you're concerned about one, free confidential support's available 24/7. Call the Veterans Crisis Line by dialing 988 and then simply pressing 1. We stand here today to share with veterans in crisis and their loved ones key messages to provide them with hope, optimism, and a way forward for a bright future. Thank you to all our veterans, service members, and their families for your service to Pennsylvania and our country. Next, you'll hear from Secretary of Agriculture, Russell Redding. Thank you.
Yeah, good morning and welcome, Major General Schindler. Thank you for the kind words and tone and support for our veterans. On behalf of the Department of Agriculture, we're very proud to stand with my colleagues to raise the awareness of suicide prevention in this week, but agree, this is not a conversation left to one day or 1 month. It is a conversation all year, and admittedly pushes us out of our comfort zones. Right? It is difficult to talk about because we all know the implications of a suicide and the effects on our community, our families, and beyond. The farmers in the agricultural community face unique challenges here in Pennsylvania as well as around the country. You know, they work alone, they live where they work. You know, the pressures of markets and weather, business transition, legacy, add to that a pandemic. And you end up with many, many stressors that can weigh heavy on individuals and their families. These jobs can be rewarding, as we know, when everything goes well. When they don't, it is a recipe for stress and much worse. But suicide prevention is about saving lives. So when our loved ones, neighbors, and others who we care about are experiencing mental health challenges which they may not even realize, it's important that we recognize the signs and know what to do and what resources are available. It's making sure that we don't miss the signs and that we don't avoid the conversations. As we've experienced, rural and agricultural communities tend to have very limited access to mental health services, which can make it difficult for the farm community to get support and when they need mental health intervention. To help address this, the Department of Agriculture last year worked with the U.S. Department of Agriculture on a grant from the Farm and Ranch Stress Assistance Network. And we're very pleased to have this resource available. We immediately began working with the network, which is a national network of services that provides education and training for healthcare professionals, as well as the promotion of the Ag Stress helpline. I'm pleased to have Dr. Allison Maloney here today and Mark Kritz with us as well. So thank you for your service. The AgriStress helpline is available 24 hours a day, 7 days a week to help the farmers, the farm families, and their communities as well. Very easy to access. Call or text 833-897-2474. Nearly 50 people have called the AgriStress helpline looking for support for themselves and their families, so it works. And although we're pushed out of our comfort zone, again, I just ask all to think of our farm community, the needs that they have, the stress that they're under, and what they do for us every day, and that each of us engage in this conversation. You can help. Again, 833-897-2474 for help. Thank you. And pleased to introduce my colleague, Secretary Jen Smith.
Thank you, Secretary Redding. Hello, everyone. I am Jen Smith, Secretary for Pennsylvania's Department of Drug and Alcohol Programs. As we stand here today in recognition of Suicide Prevention Month, I also want to point out that it coincides with a very important month in my world, and that's National Recovery Month. National Recovery Month is a time to celebrate the lives that have been saved through recovery from a substance use disorder. Substance use and mental health disorders are among the most prevalent risk factors causing someone to consider, attempt, or die by suicide. In honor of both Suicide Prevention Month and National Recovery Month, my message is the same. I want to remind all Pennsylvanians that you are not alone. And that's whether you're struggling with your mental health, feeling like the burdens of life are too much, maybe you're just beginning your recovery journey, or maybe you're living your best life, substance-free in recovery. We can all play a role in preventing the loss of someone we know or love to a suicide death by letting them know they are loved and supported. I encourage all individuals and families in recovery to share your story and to have those tough conversations. By speaking openly about our struggles, we can help individuals find the courage to seek the treatment they need, whether that's for mental health, for substance use, or both. In closing, if you know someone who is struggling with a substance use disorder, please let them know that help is only one phone call away. I'm going to share one more resource. You've heard so many already today. Our Get Help Now hotline is available 24 hours a day, 7 days a week, all 365 days a year, and someone is waiting at the other end of the line to take that call. The number is 1-800-662-HELP. We'll help you navigate local resources for treatment or recovery options. May the remainder of your September be filled with both renewal and hope. And now it's my pleasure to introduce my colleague, Secretary Robert Torres from Pennsylvania's Department of Aging.
Thank you, Secretary Smith. On behalf of the Pennsylvania Department of Aging, I'm pleased to be here in recognition of Suicide Prevention Month to help raise awareness regarding the importance of suicide prevention for older adults. Given the current size and the projected increase in Pennsylvania's older adult population who are 60 years and over, we need to ensure adequate access to resources and supports to meet the demand for mental health services. Older adults are at greater risk for social isolation than other age groups, and we know that social isolation adversely impacts older adults and can lead to feelings of loneliness and depression that can negatively impact their physical and mental health status. We also need to eliminate any stigma that would discourage older adults from seeking mental health services. Family and friends can help support older adults in this regard. According to data from the Centers for Disease Control and Prevention, adults aged 75 and older have the highest suicide rate, particularly men in this category, who has the highest rate compared to all other age groups. This reflects a clear indication of unmet mental health needs in the older adult community. Last year, to help address depression, Pennsylvania became the first state to independently offer training on and administer a program called Healthy Ideas, which stands for Identifying Depression and Empowering Activities for Seniors. Healthy Ideas is an evidence-based depression self-management program that brings together the state's aging network and the mental behavioral health community to help improve the identification of symptoms of depression among older adults and to help them learn how to properly manage depression. Currently, 15 area agencies on aging administer the Healthy Ideas program, with more agencies working to offer it soon. It is conducted by trained staff, either in person in an older adult's home or by telephone or video chat over a 3 to 6 month period. Older adults or their caregivers can learn more about the Healthy Ideas program or get contact information for their local area agency on aging to learn about other mental health resources that may be available by visiting our department's website at aging.pa.gov. I also want to take this opportunity to mention the PA Link to Aging and Disability Resource Centers, also known as PA Link. PA Link assists older adults and individuals with disabilities by providing information and connecting them to supports including assistive technology to access telehealth services, check-in calls, and options to help reduce social isolation. Any older adult needing support can contact the PA Link call center at 1-800-753-8827 or online at carelink.pa.gov. We all can play an important role in suicide prevention by emphasizing the importance of connecting with others, learning or helping others to cope with stress, and making appropriate referrals to supportive services. It is now my pleasure to introduce Department of Education Acting Secretary Eric Haggerty.
Hi. Good morning. I'm Acting Secretary of Education Eric Haggerty. Thank you for including me in this important event. In my role, I'm fortunate to travel the Commonwealth and meet students who come from all walks of life. But one thing they all have in common is that they have a bright future. Unfortunately, though, all too often these futures are cut too short, and it's incumbent upon us all to provide the support these students need to survive and thrive. It might be easy to think that there are just a few students at risk of suicide, but recent survey data has actually shown that nearly 20% of Pennsylvania's K-12 students seriously considered suicide in the last year. That's 1 in 5 kids in the Commonwealth. And when I was in second grade, I was one of those kids. I found myself in an emergency room after a brush with suicide, but I was fortunate to get the help and support I needed in that moment from mental health professionals. So as someone who has faced my own mental health struggles in the past and has struggled with depression and anxiety, I want to tell any students listening today to just hang on. It will get better. There are so many resources, as folks have mentioned today, like 988, that are available to those in need at any time. And we are all gathered here today to support you. This Suicide Prevention Month, let's ensure that all of these partnerships continue to keep Pennsylvania students safe, happy, and well. Thanks so much, and I'm going to turn it over now to Melissa Batula, Acting Executive Deputy Secretary of the Pennsylvania Department of Transportation.
Thank you, Secretary Haggerty, especially for that personal story. I think that really brings it home for all of us. So again, I'm Melissa Batula. I'm the Acting Executive Deputy Secretary at PennDOT, and I'm very humbled to be here with such an esteemed group of folks to really talk about this important topic. Of course, safety is a central mission to everything we do at PennDOT, and we directly interact with the public each and every day across our transportation network, and we're proud to take those opportunities to share important information with our customers, including information about suicide prevention and how to get help. This includes messaging at our welcome centers and our 511 PA travel information app, even on our roadways and our driver license centers. And there are some simple things we can do that can potentially save a life. The safety of our employees who work so very hard day in and day out to maintain our transportation system are always on the top of mind as well. We've spent a lot of time talking about things like equipment safety and the importance of driving the speed limit through work zones. But in addition to the physical safety of our workforce, their mental health and well-being is so important as well. We too have been touched at PennDOT with suicide within our workforce, and I have to tell you, it's absolutely heart-wrenching. And when we look at the construction industry, the statistics related to suicide are really shocking. The CDC found that men working in the construction industry are almost twice that of men working in other industries with the rate of suicide. The suicide rate in our industry is 5 times greater than the rate for all fatal work-related injuries in the workplace. We need to take this very seriously. The more that we can do to actively destigmatize and raise awareness about mental health, the better. And we really need to be looking critically at the culture. We must move past the tough it out, be a man, and attitudes such as that, and really work to remove the stigma that's preventing people from seeking mental health. It's okay not to be okay sometimes. And for our employees out there, we care about you. And we appreciate what you do every single day. And to all Pennsylvanians, you've heard it before here today, you matter, you're not alone, it's worth it. So I'm happy now to turn things over to Mike Humphreys, who is the acting commissioner at the Pennsylvania Insurance Department.
Thank you, Executive Director Batula. I am Mike Humphreys. I'm the Acting Insurance Commissioner at the Insurance Department. I first want to thank the Department of Human Services for pulling everybody together today for this important event. I'm truly honored to stand with my colleagues today at this important time and really appreciate DHS for organizing it. Over the last 2 years, there's been significant changes in mental health parity laws that require health insurers that cover mental health and substance use disorder benefits to cover those benefits no less favorably than they cover physical health benefits. To make sure we're keeping up with the changes in those laws, the department now requests mental health parity analyses is part of our front-end form review process for qualified health plans, such as those that you would purchase on Penny, the state-based marketplace. Through our discussions with insurers, we've requested changes to insurer plan designs for the upcoming 2023 plan year. Some examples of those changes that we've requested include removing cost shares like co-pays or co-insurance for services such as office visits, urgent care, and rehabilitative therapy, including occupational therapy, speech therapy, and physical therapy, when those services are provided for mental health condition or substance use disorder. We've also sought to remove visit or session limits for mental health and substance use disorder habilitative and rehabilitative services. Removing these limitations and restrictions should make mental health and substance use disorder care more accessible and affordable for consumers. While the department's made great progress during the review of 2023 plans, we'll continue to work with insurers to make sure that the health insurance products are being marketed and sold are compliant with mental health parity laws, both at the federal level and compliant with state law. My message today from PID is simple. We are here to help. Cost should not be an impediment to seeking important crisis services. Let us help you navigate the insurance challenge you may have and better understand your policy and what benefits are available to you. We are available at insurance.pa.gov and want to serve as a resource to those in need. In addition, though, to overseeing PID, I've had the privilege of being asked to co-chair with DHS's Dr. Dale Adair, the Pennsylvania Behavioral Health Commission for Adult Mental Health. The commission is made up of more than 20 experts in behavioral health with backgrounds that range from peer support groups to managed care organizations. At the commission, we're tasked with issuing a report on recommendations on how to best allocate $100 million to improve the behavioral health climate in Pennsylvania. We hope to deliver on that responsibility soon with recommendations focused on workforce, services, including crisis services, and law enforcement, among other critical areas. And with that, I'd like to turn it back to Deputy Secretary Kristen Hauser.
Thank you, Commissioner Humphreys. And to each of our partner agencies here in Governor Wolf's administration that are so integral to this work. It's a large group of us today because we need all of us to do this together. We know, however, that in order to prevent deaths by suicide, government also needs to have strong partners in the behavioral health field who can share their clinical experience and expertise from working with people who've survived suicide attempts and others who've been affected by suicide. Their on-the-ground experience is essential to guide and amplify these kinds of efforts locally. So I am pleased to introduce Dr. Matt Winterstein, who is Associate Professor in Psychiatry at Thomas Jefferson University and Vice Chair of Prevent Suicide Pennsylvania. He and his team are fabulous partners and colleagues to the work we do here at DHS and elsewhere in the Commonwealth. So, Dr. Winterstein.
Thank you, Deputy Secretary Hauser. Suicide is one of the most preventable causes of death in Pennsylvania, in the United States, and across the globe. While oftentimes suicide prevention falls into the hands of behavioral health, the esteemed group of state officials speaking today exemplifies Pennsylvania's commitment to a broader, comprehensive public health approach to suicide prevention. As Board Chair of Prevent Suicide PA, I'm affirming our commitment to assisting Pennsylvania in carrying forward the goals and objectives of the state suicide prevention plan. As an organization, our mission is to support those who are affected by suicide, provide education, awareness, and understanding by collaborating with the community to prevent suicide and reduce the stigma associated with suicide. To this end, we partner with numerous state, county, and community groups to carry out a number of projects and programs. We have a Drive Out Suicide campaign, which has existed for several years to raise awareness across our roads all over Pennsylvania. We've partnered with state departments, such as transportation, to increase broad public health awareness of suicide risk and local and national resources available to support those in crisis, including the 988 Suicide and Crisis Lifeline. We are entering our 11th year of hosting an annual PSA contest that we do for youth suicide, where we receive submissions from Pennsylvania high school students in categories for posters, 30-second videos, 60-second videos, and 30-second audio clips. We are committed to continuing to infuse schools and communities across the Commonwealth with high-quality submissions and awareness messaging from our students. Our partnership with our 2 state Major League Baseball teams helps to not only recognize the winners, but also share the messages and support and put this into the hands of people all over the Commonwealth in ways that we traditionally haven't used. We deliver trainings in areas that have evidence for reducing suicide attempts and deaths, such as counseling on access to lethal means. We do this program through a lot of different resources, including the Department of Corrections, and working with them and behavioral health providers and other settings to reach those who are at high risk for suicide. Finally, we are proud partners of the statewide effort to both support the promotion of 988 and work with state legislators and the communities they represent to broaden the reach of crisis services across the Commonwealth to not only answer crisis calls, but have appropriate responses to community crisis needs, including the enhancement and expansion of mobile crisis teams and crisis respite centers. In closing, it's a tremendous honor to stand within this rotunda to raise awareness around suicide prevention and encourage everyone to break the silence of suicide by speaking with others around you about your concerns and your needs. Today's efforts reinforce a broad commitment to reducing morbidity and mortality associated with suicide. And if you here today are struggling with thoughts of suicide or know somebody who is, I encourage you to reach out for help and to know that help does exist. And with that help, hope abounds. At this time, I'd like to introduce Amanda Blue, who will share with you her family's poignant experience of existing within the suicide loss community.
Good afternoon. Thank you, Matt. My name is Amanda Blue, and I am chair of the Chester County Suicide Prevention Task Force and the administrator of the Mental Health First Aid Program in Chester County. Either one of those titles might be a good reason to be here today, but that's not why I'm here. I'm here because before I became the task force chair or the Mental Health First Aid administrator, I was a graphic designer, living with my husband of 17 years and my 2 children, who in 2008 were 11 and 13. At that time, my life was pretty ordinary. I worked part-time doing design, my husband worked in sales, and my kids played soccer. We were your neighbors. But in 2008, our ordinary life took a turn. It was March 26th, in fact, when we all left the house in the morning and everything changed. My husband took his life that day, a fact that would forever alter the lives of my family and ripple out to many others. And a fact that I would then have to relate to my children. It's hard enough to tell your 11 and 13-year-old that their father has died, but when you have to explain that he died by suicide, it's hard to know which part is worse. My husband did not have a diagnosed mental health condition, nor a history of depression. He did have heart surgery 6 months before his death, a circumstance known to cause depression. But there were no obvious signs that he was struggling, at least not signs that weren't easily attributable to rehabilitation. He was back at work, and we thought the worst was behind us. Over the next 3 years, the kids and I would work at constructing a new life. My daughter had some help from a therapist. My son was reluctant. I sought therapy for myself for a while, but being a newly single mom, working full-time, that didn't fit into my life very well. In March of 2012, my daughter was getting ready to graduate. My son was almost finished with his first year in a new STEM high school, but he was beginning to struggle for the first time. It was a transition year, and the work was demanding, but when he began to sink further down, he finally went to see a therapist. After 4 sessions over 2 months, she suggested that he could decide if he wanted to continue. She thought he was doing okay. 2 weeks after his last session, he came home from school and killed himself. I'm sure I don't have to describe the devastation of losing a child. He was 2 weeks away from his 15th birthday, and it was a turning point in my life. Like my husband, he had no mental health diagnosis. But also like my husband, he did have at least one risk factor. Being a survivor of suicide loss actually puts you at higher risk yourself. These risks, heart surgery, being a survivor of loss, both put you at higher risk. But they're not the signs you read about every day. Most people associate suicide loss with mental illness or maybe substance abuse. People expect to see it in families that are struggling through difficulties like divorce, incarceration, poverty, or illness. But I'm here as a reminder that it happens to families like mine every day. Suicide knows no socioeconomic, ethnic, or cultural boundaries. Assuming that this only happens to people or families in obvious crisis sets up a sort of us and them. And though that may help us sleep at night, thinking we're safe because we don't have any of those risk factors, in truth, we can't always know how difficult life is for someone else. There are people living with pain that we can't see, even in our own families. But we can ask. We can notice when someone is having a difficult time, and we can ask if they're okay. We can ask if they need help, and we can listen, which is a critical piece of prevention. In fact, it may be among the most important things we can do as individuals. I teach people about suicide prevention regularly. I teach them about warning signs and risk factors and what it might look like if someone is in crisis. But at the end of it all, what I'm teaching them is how to notice when someone may need help and to intervene. For many people, having someone really listen without judgment can be the difference in hanging on for another day or not. And sometimes we have to be brave enough to ask the hard question, are you thinking about suicide? And then we have to be brave enough to hear the answer. But that single moment, that single interaction can save a life. So if you're wondering to yourself now, what can I do about this? That's the first thing. You can lean into what might be an awkward conversation when you notice that someone is struggling. You can ask them if they're okay and offer some time to listen. And you don't need to be a therapist for that. You can help them call the crisis line for help and be there to support them through it. At the task force, we often say that any act of kindness can be suicide prevention. I'll never know what might have saved my husband or my son. But since I've started teaching people and hearing their stories, I've heard firsthand how simple things opened the door for people to get help. And anyone can do it. Although we can't prevent all, suicide is preventable. I hope that if you find yourself worried about someone, you'll remember this moment and the idea that you, all by yourself, can make a difference. Thank you.
Amanda, thank you for sharing your story and for reminding us all that we all have little peeks into people's lives and the opportunities to make a difference, to alleviate burden, and to demonstrate that somebody we care about really does matter to us. It is hard to ask those questions. I have done it myself, and it's hard to hear the answers when you're hearing what you didn't want to hear. But it makes the difference to listen. So thank you very much for sharing your story. So before we close and take questions, there's just one last thing I would like to do, which is to recognize and thank the many different professionals who work in behavioral health, in education, in substance use treatment, and in all of the other fields who are interacting with individuals in Pennsylvania who are going through a crisis. From the staff at the call centers across the state to county officials that oversee local behavioral health services, social workers, peer support specialists, doctors, nurses, so many others, your impact on the health and well-being of Pennsylvanians is greater than you know. It's one of the things that those of us in human services know. We rarely get to see the outcome of our efforts, but you just have to have faith and know that you are making a difference. This work is not easy, but it does save lives, and we can't thank you all enough for what you do. For others, if you are interested in getting involved in this work, you can visit 988lifeline.org to find a call center near you and learn how you can possibly join their team and support their work. The workforce has hit behavioral health. We do need your help, and if you have the interest, there are opportunities out there. So thank you so much for your time and attention, and we're happy to take questions now if you have any. Yes?
How do the 2020 figures compare to 2019?
How did the 2020 figures compare to 2019? Off the top of my head, I cannot answer. Dr. Winterstein, do you know off the top of your head?
Sure.
The rates.
In 2019 was the first year in probably about 2 decades where the suicide rate actually went down. It also went down in 2020, which is a little counterintuitive. People were concerned the pandemic and ensuing depression and anxiety that occurred for many people during that time would have increased the suicide rate. We discovered that it actually, the number of suicide deaths, both within Pennsylvania as well as across the country, went down.
Thank you. Other questions? Okay. Well, thank you so much. We will all be around if there's anything you'd like to snag us with on your way out, so thank you.